Hi, my name is Dr. Eric Arzubi. I'm a board-certified child and adolescent psychiatrist, and I'm CEO and co-founder of Frontier Psychiatry. So today I'm here to talk to you about a critical public health crisis that's emerging, that's affecting our young patients, the substance use and vaping epidemic. So recent data shows that e-cigarettes are now the most commonly used tobacco product among U.S. youth, with over 14% of high school students and 3% of middle school students reporting using e-cigarettes at the moment. So as providers who take care of youth and clinicians who take care of youth, we are on the front lines of prevention, early detection, and intervention. And the actions we take in our clinics can literally save lives to really combat this crisis. So first of all, let's look at the numbers. In 2024, like I said, more than 14% of high schoolers and 3% of middle schoolers reported using e-cigarette use. And these numbers are likely underestimating the true scope, since people tend to underreport. But vaping isn't the only problem. We're seeing increased marijuana vaping, especially with THC products, alongside with persistent misuse of alcohol and prescription medications like opioids, stimulants, and anxiety medications. Alcohol is still the most widely used substance among teens, but the landscape is shifting pretty quickly. What's especially alarming is the combination of substances that many adolescents are using. We're not just dealing with isolated experimentation. Many youth are actually polysubstance users, which compounds the risks that they're facing. So why is vaping such a big deal? There are three reasons. First of all, misconceptions. A lot of teens think that vaping is safe, just flavored water vapor, or at least less harmful than smoking. And this just being flavored water vapor and less harmful than smoking it couldn't be further from the truth. Second, addiction problems. Modern e-cigarettes deliver extremely high concentrations of nicotine, often more than traditional cigarettes. And nicotine exposure during adolescence has really profound effects on the developing brain and affects attention, learning, mood regulation, and impulse control. So the addiction around nicotine can happen quickly. And then thirdly, the serious health risks that are associated with all of this. We've seen cases of EVALI, which stands for e-cigarette or vaping product use associated lung injury. And again, lung injury, which can be life-threatening. So beyond that, we're documenting respiratory problems like chronic bronchitis and asthma exacerbation. Cardiovascular risks and long-term neurological impacts are also problems that we're beginning to understand. So let me just briefly explain EVALI, since it's a term you'll hear and need to recognize over and over. So again, EVALI, spelled E-V-A-L-I, it's an acronym, stands for e-cigarette or vaping product use associated lung injury. It was first identified in 2019 when thousands of previously healthy young people suddenly developed acute respiratory illnesses. Symptoms include shortness of breath, chest pain, cough, fever, GI symptoms like vomiting and diarrhea. So what's the culprit? It's vitamin E acetate. That's a thickening agent that's used and illegally added to THC vaping cartridges. When inhaled, vitamin E acetate disrupts lung surfactant. It's a layer, it's an important chemical layer in the lungs. It's the substance that keeps our alveoli, or the pockets of air, from collapsing in our lungs. This leads to really high inflammation, lipoid pneumonia, and in extreme cases, acute respiratory distress syndrome that requires ICU care and mechanical ventilation. More than 50% of EVALI patients required ICU admission, and tragically, some died. So the outbreak peaked in 2019 when we first started learning about these cases, and long-term studies show that survivors experience persistent cognitive impairment, respiratory symptoms, anxiety, and depression months to years after the diagnosis. The message is pretty clear. Vaping can cause severe, potentially life-threatening lung injury. So who's most at risk? It's really important that we understand the risk factors to help us identify who the vulnerable patients are early on. So key predictors include peer use. So if a teen's friends vape, they're much more likely to start. And kids and youth with mental health conditions like anxiety, depression, ADHD, and family history of substance use or exposure to trauma are also risk factors. We know that certain populations are disproportionately affected, including youth in rural areas with limited access to mental health services, LGBTQ plus adolescents who face higher rates of bullying and discrimination, and teens from marginalized communities. And we can't ignore the role of social media. Platforms amplify peer influence, they normalize substance use, and they expose teens to targeted marketing that glamorizes vaping while downplaying the risks. Many teens are seeing vaping as trendy, cool, and harmless, and these are perceptions that we need to actively counter in our clinical encounters. So what can we do? What's our role? First, screen and assess. We need to routinely ask about substance use, including vaping specifically, at well child visits and at sick visits. We need to use validated screening tools, but most importantly, build a relationship, build rapport. Ask in a non-judgmental, conversational way. Have you ever tried vaping or e-cigarettes? What about your friends? Teens are more likely to be honest when they don't feel like they're being judged. So again, be careful about the way that you ask the question. Secondly, education and prevention. When we educate teens and families, personalized messaging works best. Instead of generic warnings, talk about their goals. For example, thinking about what are their athletic performance goals, their appearance, and their academic success. What are they trying to achieve, and how are these substances potentially getting in the way of their goals? So, and don't forget to include nicotine, the substances we talked about, and alcohol. Try to correct misconceptions head on. Make it clear that vaping is not safe, that it's highly addictive, and it can cause serious harm. Third, intervention and treatment. So if a patient is vaping or using substances, early brief interventions can be highly effective. Use motivational interviewing techniques. They help them identify their own reasons to quit and work with them to set realistic goals. And also remember what I said before about helping teens identify how these substances can get in the way of them achieving their own goals. For nicotine dependence, consider behavioral therapy, and in appropriate cases, discuss pharmacotherapy or medications like nicotine replacement therapy, bupropion or Wellbutrin, or varenicline, though evidence in youth is limited on some of these medications. Critically address co-occurring mental health needs like anxiety, depression, and ADHD, because these often drive substance use, and treating these conditions is essential for successful stoppage or cessation of misusing these substances. And then fourth, advocacy. Beyond the exam room, try to get involved. Support school-based prevention programs, community education programs and efforts, and policies that restrict youth access to vaping products. Encourage families to have open conversations at home, monitor for warning signs, and model their own healthy behaviors. Again, like many of the things that we're facing, starting at home is critical. So in the end, let me leave you with 3 takeaway messages here. First, the vaping and substance use epidemic is evolving rapidly. What was true last year may not be true today. Stay informed, stay vigilant, and update your clinical approach as new evidence surfaces and emerges. Secondly, you, pediatric clinicians and providers, are uniquely positioned to make a difference. You have trust, access, and influence with young patients and the families that they bring to the exam room. Use it. Screen consistently, educate thoughtfully, intervene early, and advocate loudly. And again, build rapport and speak to the patients with no judgment. And third, you're not alone. We're all facing the challenge when it comes to taking care of our youth patients. There are excellent resources that are available to you. The American Academy of Pediatrics has clinical guidelines on substance use screening and intervention. The CDC provides up-to-date information on vaping risks and EVALI. And NIDA, the National Institute on Drug Abuse, offers free educational materials for teens and families. And for patients who need more intensive support, refer them to local treatment programs, counselors, and addiction specialists. Together, we can turn the tide on this epidemic. Our patients are counting on us, and our communities are as well. Thank you.